I'm Dr. David Kulla here with Synergy Wellness in New York City. Today we have Sebastian, who has a spondylolisthesis, but it's actually a spondylolytic listhesis. And what that means is you can have spondylolisthesis, as you can see, is pretty common. Well, not that common. It affects about 6% of the population, okay? It's when a vertebra, typically, but not always, L5, the lowest lumbar vertebra, the lowest vertebra in our lower back. But again, we have some patients that have the issue with their neck, and it can happen anywhere in the spine, but more common at L5, most common. So he has a forward slipped vertebra of L5, and his being a lytic listhesis makes it a pars defect or a pars fracture. Now, he could be born that way. He could have a pars or a bone defect causing the spondylolisthesis from lifting something heavy. My father actually has a spondylolisthesis with a pars fracture. His was able to heal back together. Some don't, and what we want to do is we want to make sure we take a flexion extension view. So not only do we take an x-ray, we take an oblique x-ray, we take a few more x-rays than we normally would with lower back pain. And one of those or two of those x-rays would be him flexing forward and him flexing back like this. And the purpose is to see if that L5 vertebra is stable. If it's not stable, we refer out. And I knew that it was stable, but you got to make sure. It can't hurt to check. It's just 2 extra x-rays. But if you have a spondylolisthesis, you're going to want to try flexion distraction technique. Spondylolisthesis is difficult, and sometimes it causes spinal canal stenosis, and and that makes your legs feel heavy. He actually came in here for upper back pain and had some lower back pain, but it wasn't really his main complaint, right?
Yeah, that's exactly right. Before I came here, I thought that it was just what having a back was like all the pain I was like constantly in. But then it was kind of a relief to find out there was a reason why it was all going on.
Yeah. So, something told me there was something wrong with his lower back, so we took the x-rays, and that's how we found it. And that's really the only way to check or to find a spondylolisthesis. So we're going to do some flexion distraction here for him. And then something that's real important is to check his psoas muscle, because the psoas muscle attaches onto the vertebral body, the medial to anterior-medial, and if that's really tight, that's going to pull that spondylo further forward, okay? So that's the last thing we want, right? So that's why I do this flexion distraction technique, and then I follow it by checking his psoas muscle on both sides. You have a psoas on the left and on the right, folks. And he complained that he has back pain when he bends down. Is that correct?
Correct, yeah.
Yes, so that's a clear indicator to me that if he has back pain when bending, then that means his back is, or his psoas muscle's really tight already from the start. Okay, so we're gonna fix that. How you doing there? Any pain down into the legs?
No, feeling pretty good.
Yeah, and luckily he doesn't have any pain into his legs. A lot of people with spondylolisthesis will get numbness, tingling in the legs feel heavy, or even pain shooting down the legs, because the sciatic nerve comes out right there at L5, right? So, okay, now let's check your psoas muscle. The only way to check the psoas is, or to release it, is through the stomach. You cannot do it through the back, okay? Hands up in the air. This is just a little test I do to check for the tighter psoas, and it's definitely the left side. And I can tell by one arm is shorter when I extend them over his head. We fixed any shoulder issues that he had, so it's not that. But if they do have a shoulder problem, obviously that might throw things off. It's not a telltale sign for everybody, but for him it is. And just relax here. And what you're going to do is go between the belly button and the ASIS, which is the front of the top of the pelvis right here. The post that comes right to the front here. So right that pointy edge right there, halfway in between. So from here to here, right halfway in between. That's the psoas right there. And you got to get in there pretty good. How's that?
Tender.
Yeah? Okay, yeah. So my guess is his right side will also be sensitive. But when this muscle's tight, it's first of all, it's a trunk flexor, so forward and lateral bending. So if he's bending and he's feeling it more in the lower back, that tells me it's already tight. It's also a hip flexor, and it runs down along the spine and attaches to all the lumbar vertebra, then runs through the groin and then attaches into the inside of your thigh bone, you know, all the way deep there under the groin there, onto your leg bone, okay? And that's what makes it that hip flexor and trunk flexor. So we're just gonna loosen this up here. And sometimes when you have a tight psoas just on one side, that can create a slight scoliosis curve because that one side is tight, bending the spine to one side. Good, how we doing there, okay?
Good, yeah.
All right. So we're gonna show you some x-rays of a spondylolisthesis. We'll put them right up on the screen here and show you what a regular spondylolisthesis looks like from a lateral view. We won't even show the oblique view, and then I'll show you the flexion and the extension view, and you can see how the vertebra doesn't move further forward than just the straight lateral x-ray, and you'll see that, and you can compare that. And that tells us that the spondylolisthesis is stable, okay? And that's definitely something you want to check before you have chiropractic care, or just in general when you're dealing with a spondylolisthesis. It's something that's good to know. Not nearly as tender on this side.
Not nearly at all, yeah.
So there you go. It's not as sensitive on this side, but it's still tight. So
it's actually crazy the difference.
Were you having a harder time putting your left shoe on or your
Yeah.
left sock than your right?
Totally, yeah.
Yeah. So this is going to make it a lot easier for you to bend. It's a really tough muscle to stretch on your own. There's all sorts of videos out there. I've done a video on how to stretch your psoas. There's a bunch of other videos out there how to stretch your psoas muscle on the internet, but it's really tough. None of them compare to what I just did right there, having somebody get in there and really release it. It's possible you could do it yourself too. So over the weekend or the week when you're in London, you can lay on your back, reach your hand here, and kind of dig in there a little bit and go in a circular motion.
Cool.
And try to loosen it up. It's
Yeah,
not
I
easy.
mean,
You're not going to get as much leverage as I have, but it might help you a little bit if you run into a crisis.
Yeah, that's great to know, definitely.
Yeah. Okay, guys, I hope you guys learned something from this video, and certainly learned something about spondylolisthesis and the difference between a lytic listhesis and a regular spondylolisthesis. And then you have a retrolisthesis, which we haven't even talked about, where the vertebra pulls back. We won't get into that right now, but psoas muscle is key to release when dealing with that. You're all set. You can come on up.
Great.
Thank you guys so much. If you got anything from this video, or even if you just like this view of the Empire State Building and the Chrysler Building, give me a like and don't forget to subscribe. Appreciate you guys.